The concept behind this safety DVD is to show anyone connected with an oxygen home care supply how oxygen enrichment can make a fire burn far more intensely and rapidly than it would do ordinarily. Medical oxygen has a percentage of purity of approximately 98%, whereas the oxygen we normally breathe has a purity of only 21%.
Since 2006, BOC Healthcare have experienced a number of burns and house fires suffered by patients ignoring our safety instructions. What we'd like to do is demonstrate to you with Essex County Fire and Rescue Service the dangers of ignoring oxygen safety training.
This demonstration illustrates what can happen to a person who ignores the safety training in relation to the safe use of their oxygen. In this particular scenario, it depicts a person smoking whilst using their oxygen, but it can relate to any ignition from a naked flame or heat source, or when you use your oxygen with oil-based creams. In this fire demonstration, the mannequin patient has been purposely set up not to work correctly, as the patient's tubing is entangled around their neck and arm, thereby bypassing the fire brake. This can potentially happen when patients either remove fire brakes or entangle their tubing and therefore bypassing the fire brake. You can see from this fire that the mannequin and its clothing are burning extremely well, primarily due to the oxygen enrichment. Whilst using oxygen, the surrounding clothing becomes highly enriched from the oxygen that you do not use. This is because you only consume approximately 1/3 of the oxygen supplied, so 2/3 are effectively enriching your clothing and other materials nearby. Virtually any substance, when enriched with oxygen, will burn far more proficiently, and this is why it is vitally important that you follow all safety training. What you can't see from this demonstration is the fact that if this had been a real person, the fire would have followed the path of the oxygen. That is to say, the burn could follow up the nose and possibly burn the throat, as well as setting the surrounding clothing alight. Remember the following points. You must be at least 3 meters from a naked flame or 1.5 meters from a heat source whilst using your oxygen. Never smoke whilst using your oxygen, and this includes electronic cigarettes, which can be just as dangerous as normal cigarettes. If you really must smoke, you must wait at least 20 minutes after using your oxygen before you smoke, as your clothing may be enriched with oxygen and will burst into flames very easily if you go near a naked flame. Do not use a gas cooker whilst using your oxygen. Never use any electrical appliances, including razors, hair dryers or irons, whilst using your oxygen. Always turn your oxygen off when it is not in use. Do not use any oil-based cream or ointment in conjunction with your oxygen treatment. Make sure, if you have to use creams, that they are water-based, such as KY jelly or Roezid. We recommend you have a smoke detector fitted to each floor of your house, and make sure that you keep them in a working condition. You can contact your local fire service for advice. The extensive fire in this room was extinguished by the standby fire safety crew. If this had been a real home, it could quite easily have become out of control, not only burning this room, but also the whole house and potentially any connected properties. Ignoring safety training not only puts you in danger, but also those who live with you, near you, and of course the fire service who attend the scene. Please remember your training. Following that will keep you safe. This demonstration of tubing burning when the oxygen is flowing shows how the fire brake will stop the flame from progressing along the tubing when it is fitted correctly. This is why it is very important the fire brake is not tampered with by anyone. As you can see, the fire reaches the fire brake and the flames then stop. This prevents the fire from proceeding down the tubing by cutting off the oxygen flow.
As patients, always follow your supplied BOC literature. You will remain safe on your oxygen supply so long as you follow correctly your oxygen safety training.